And good afternoon. Hi, everyone. It's really good to see you all. As Agnes, today we're going to be talking about principles of hormone health. Really important topic and a very general sort of topic about well-being and health around the time of perimenopause and menopause. So essentially, I'll be explaining how hormones influence our physical, but also our emotional and cognitive health, and how we can help ourselves improve our not only the symptoms of menopause and hormone decline, but also how to improve our general health and prevent chronic diseases and diseases that we may have a genetic predisposition to. So just very quickly, menopause is diagnosed, as many of you may know, once our cycles have stopped for 12 consecutive months. And that can happen, it's acceptable sort of to happen anytime from 45 years onwards. And we don't really need, the diagnosis is actually not based on a blood test. So, quite often you may hear about a test that checks follicle stimulating hormone or FSH to diagnose it. That's just there to guide. FSH is a hormone that is released by our brain that sort of gives a signal to ovaries to release estrogen. And when ovaries are packing up or not secreting enough hormones for our body's liking, then the FSH starts to increase. So the brain starts shouting at the ovaries to release more and more estrogen, and that's not happening. And so post-menopause, FSH just remains high. It gives very limited information actually about exactly what's going on with our hormone levels. And the diagnosis of menopause is based on a clinical observation, and it's almost like a retrospective diagnosis once you haven't seen any spotting or bleeding for 12 consecutive months. And anytime after that, you are post-menopause. So it's not something that you go through or come out of. Some people, of course, don't experience many symptoms. That's fair enough, but it doesn't mean that they're not experiencing physiological changes of hormone decline. Blood test becomes more sort of helpful between, when we see some symptoms that are related to hormone deficiencies or fluctuations under the age of 45. So when the cycle pattern is uncertain, when some women have quite significant symptoms and we're unsure about what's happening, and that's when it becomes more relevant to do these blood tests. Also, if we're suspecting that there is premature ovarian insufficiency or POI. So that's basically menopause occurring under the age of 40, which happens in about 1 in 100 people experience it under the age of 40, 1 in 1,000 experience it under the age of 30. And then, of course, when we have so-called atypical symptoms, so it's not so straightforward, hot flushes, night sweats, or symptoms that we expect of estrogen progesterone deficiency. And we may be wondering, could this be something else? Could it be, for example, coming from underactive thyroid or another autoimmune problem or a rheumatological issue? So it's good to run some tests in those circumstances to clarify. But hormone health, so we're not talking about menopause, but we're talking about hormone health. It has some principles and some pillars that need attention when we discuss it, and if we want to achieve balance, optimization, and health. And deliberately, I've put the hormone balance at the bottom because everybody fixates on HRT and hormone replacement. Of course, it plays a huge and important part. But our nutrition, our movement and exercise, and again, deliberately, I've chosen the word movement rather than exercise because I think that's when you really achieve, it has to be achievable and maintainable throughout life, not just like a burst of, okay, I'm going to go to the gym for, a couple of hours every day and then stop after 6 weeks or 2 months when you've lost interest in that. But it's about movement. It's about the importance of our sleep in maintaining hormonal health and managing our stress. Stress, everybody's stress, of course, and we talk about stress quite loosely and frequently, but it is crucial when it comes to achieving hormonal balance and optimization. And I'll come to that in the next slides to explain the significance and the importance of both stress and sleep in our hormone health. So there are many metabolic changes that occurs around the time of menopause, and also there's changes in our inflammatory response to these metabolic changes as well, and they all cumulatively result in occurrence of some chronic diseases. So it's a really good time to not only management of symptoms, but to really have a good look at health in general and try to optimize and prevent diseases that might happen in the future decades of life. Protein, of course, it's extremely important in our muscle health and in our metabolism. So it's something that we should pay attention to, whether you're, even if it's, you're vegan or vegetarian, there are many good sources of protein that you can replace. It's not just meat and animal protein. Our gut health, because it's really important in perimenopausal women. It can be a source of hormone production, but also in women who are on HRT and years post-menopause, their gut health is really important because the gut is an organ that also metabolizes hormones out of our system. So if you have issues going on with your gut health, it can influence how you metabolize hormones and whether or not you accumulate hormones and run into difficulties with side effects from these hormones. So, often I hear, I feel like we need to reduce my dose or increase my dose, but in fact, we need to be looking at is gut health and making sure that the system is cleared of these hormones that you're taking. Stabilizing our blood sugar, especially in those who know they have a family history of diabetes or they know they have insulin resistance. And of course, looking after, so this is all to do with our nutrition and looking after our alcohol intake and processed food intake, because these are poor basic diet and certain alcoholic beverages, especially and processed food, they worsen our hormonal swing, they worsen our inflammatory response, and they therefore result in more weight gain, in more insulin resistance, and symptoms like brain fog, fatigue, even hot flushes. So it's a good idea to really have basically it's no different to what is good for your cardiovascular health. So it's the Mediterranean, high fiber, high fresh fruit and vegetable diet. Now, I said, stress can make a huge impact on our long-term health, and how we can reduce that. One of the ways we can reduce it is actually by making sure that we move every day and we exercise. There's various types of exercise that is, it's really good to do a sort of a combination of exercises. So if you are a walker and you walk every day, that's great. It's very good for metabolism. It's really good for cardiovascular health. Anything that increases your heart rate and maintains it at that higher rate for more than 30, 40 minutes is beneficial. But also a very important training and exercise is strength and muscle training, because it's really important for your bone and muscle health. And we know muscle is a metabolic engine, especially after the age of 40. So if you're trying to protect your muscle strength, if you're trying to protect your weight and also your metabolism, it's really important to pay attention and do a couple of sessions of strength exercises. The high intensity or interval training is particularly important when it comes to insulin sensitivity. So again, if you have an issue with insulin resistant, or if you have been diagnosed with pre-diabetes, or diabetes, but type 2 diabetes runs in the family, it's really good idea to pick up a couple of sessions of this HIIT exercises. We're trying to health for our future health for our future sort of older age, and it's extremely important to then make sure that we're doing exercises to prevent injury, to also help us to remain mobile and stable for longer periods of time. So that's activity training. So whether it is Pilates or yoga or any exercises that improves flexibility and ultimately reduces the risk of falls in older age is great to start working on in younger decades. So yeah, sleep is crucial in maintaining our hormone health, because it's during our sleep that, first of all, if you have lower reserves of hormones, hormones can regenerate during sleep. So it's, people who have very disturbed sleep, they actually go into hormonal drops and menopause at an earlier stage. Poor sleep also results in weight gain, and the mechanism behind that is by increasing cortisol. So, people who are poor sleepers, you generally speaking, they have higher cortisol levels. And cortisol, of course, is the stress hormone. Your body perceives the drop even in the hormone levels as a threat, and it releases cortisol and it disturbs sleep. And then the disturbed sleep also increases the cortisol. So it's like a vicious cycle. People who have poor sleep, they have worse time with anxiety management. Generally, they feel groggy and foggy the following day. And they're also at higher risk of developing insulin resistance. So it's really, really important to pay some time to and attention to our sleep and make sure that it is rectified. Now, everyone has innately they have a different time for a good night's sleep. So some people generally they feel fine after 6-7 hours. Some people need a bit more or a little bit less than that. But the important is the quality of that sleep as well. So if you're waking up multiple times, either because experiencing some symptoms of menopause, hot flushes and night sweats, or perhaps you needing to go to the toilet multiple times in the night, or just waking up with a bit of palpitations or in a sort of high state or anxiety, it's good to pay some time and to bring that up during your consultation so that your healthcare provider, whether it's one of us or anyone that you're seeing, can sort of sift through between these different elements and causes and give you the right treatment to rectify your sleep. Now, when our body is under stress, the adrenal glands, adrenals are the two little organs sitting on top of our kidneys. They produce a cortisol when we're stressed. They produce adrenaline when we're scared. They also produce another hormone called DHEA, which for those of you who have had consultations with us, you may have heard of it, or you may be on DHEA supplement as well. But essentially, when our body is under stress, our adrenal glands prioritize making cortisol, which is the main stress hormone, and rightly so. They have to make cortisol so that our body knows how to deal with that stress that it's been faced with. But cortisol is made from the same precursor hormone that is used to produce progesterone and DHEA. So up until your perimenopause, majority of progesterone is made at ovulation by the ovaries, but after that, adrenal gland makes some of these hormones as well, especially the DHEA, which is really good for your sense of well-being, for your energy level. And then what happens when when it prioritizes making cortisol, your progesterone level and DHEA level drop even further. And so basically cortisol demand can reduce the supply available for the sex hormone pathway. So you're not, the precursor has been used up for making cortisol, and there's no more precursor left for making progesterone and DHEA. And that's when women generally start feeling symptoms of diminished progesterone, which is waking up in the middle of the night or feeling a bit achy in their joints or feeling even more anxious, because progesterone is the hormone that has a neuro calming effect. And the DHA, of course, if that starts to diminish, you start feeling a bit fatigued and tired and just can't be bothered to do things or not enjoying the things you were enjoying before. So it's really important, like sleep, to spend some time on dealing with stress so that we can reduce our cortisol. Unfortunately, there's no tablet or no single medication that I can prescribe or anybody can prescribe to reduce your cortisol level. It's really by managing your stress, doing things that you enjoy, as well as doing things really targeted at reducing cortisol, which is like breath work or setting boundaries, saying no when you feel that your cup has been too full, and resting when your body signals that you're tired and you need to rest, whether that's in the middle of the day, if you can. Of course, for those of all of this has to be within the remit of what is feasible during that your work day or whatever. But if you are at home, or if you are in a situation where you can sleep and you're very tired after your midday meal, or just otherwise, even after late morning, if you feel tired, the best thing to do is because that way, once you've rested and had an even 20-minute nap, your cortisol level can drop and you can feel so much better afterwards. The important thing for a younger woman to really because we become better at managing and talking about menopause, actually, for raising awareness. There's been good campaigns to raise public awareness about menopause, but I think now the next step is to bring in the proactive sort of looking after our hormone health and preparing for future decades a little bit younger. So not to think that, I'm in my early 30s, mid 30s, this is not for me. I don't need to do anything about that until my periods start diminishing or starting playing up. So perimenopause starts earlier than most of us realize. And we can support our future health by optimizing and also modifying our lifestyle. So we can do that through supplements. We can do that through checking our hormone levels and replacing whatever that is missing and is giving us symptoms, and really looking at appropriate treatment for anything that we know we can have a predisposition to. So for those who have a higher incidence of osteopenia or osteoporosis in their family, for those who know they have a genetic background of insulin resistance or diabetes, is to start doing that work and being really proactive earlier when they're still having maybe even regular cycles. So yeah, as I said, perimenopause can happen at a much younger age. Definitely in 30s, and for those who have premature menopause, it can happen in their even late 20s, early 30s. And some of the symptoms, or majority of the symptoms actually, is very similar to menopause. So they can have brain fog, they can feel more anxious, and sleep disturbance. Now, the anxiety and sleep disturbance that happens much younger, in our maybe mid 30s onwards, is due to the lack of the hormone progesterone, because when we ovulate mid-cycle, the sac that remains behind on the ovary releases progesterone, but not we don't always ovulate every time we have a cycle, and more cycles become anovulatory as we age, and so that results in progesterone deficiency, and that sort of demonstrates itself by sleep disturbances, so waking up in the middle of the night and rising anxiety, because again, progesterone is the hormone that calms down the nervous system. Also, you can feel quite foggy in the brain. That it can be due to hormonal fluctuations, as well as poor sleep and waking up and poor quality of sleep. But also they can experience changes to their cycles. The cycles can become shorter. They can become heavier. So that's and often, when they're heavier, they definitely don't think that this could be due to any perimenopausal or hormonal fluctuations. But in fact, one of the things progesterone does is to make sure that you have a normal sort of quantity of blood loss every cycle. So it stabilizes the endometrium, the lining of the womb. And when that's not there, you can pass clots and have quite a larger quantity of blood loss, and cycles can become shorter. And of course, the weight changes that happens with these hormonal fluctuations. So you don't really need to wait for your periods to stop to ask for help. You can start at much, earlier. If you notice any of these symptoms, you can at least just have a one-off blood test and have that discussion with a specialist. But post-menopause, there's higher risk of various chronic diseases. We know that, at the time of menopause, also in late 40s, early 50s, that's when quite a number of the other diagnoses also show up. So, I see quite a number of women with problems with their cholesterol level when they didn't have it before. So disturbance of the good and bad cholesterol at that point, and higher blood pressures, which are independent risk factors for cardiovascular disease, which is the #1 killer in women. So we always sort of fear and talk about things like breast cancer, etc. But in fact, cardiovascular disease still remains the #1 killer in women. And the at time of menopause is when we lose the protective measure of estrogen. But of course, at the same time, osteoporotic fractures, which is a real it can really reduce the quality of life later on in life, and diabetes. So things, chronic diseases that have inflammatory bases, and quite a number of them do. Whether they're the autoimmune diseases like inflammatory bowel disease, Crohn's, ulcerative colitis, diabetes, rheumatoid arthritis. These are disorders and diseases that show up quite more frequently diagnosed at the time of menopause, sorry, because of the lack of protective measure of these hormones as well, and including dementia and emotional or psychological problems like depression and anxiety. So what can we do to reduce our risk of to prevent the diseases in the future and reduce our risk of developing any problems? These are some of the things that I think is really, should be top of the list, starting with that movement and weight training. Because with the weight training, you're not only reducing risk of bone loss and muscle loss, but you're reducing the risk of falls later on in life. And checking our cholesterol and blood pressure. Often when I specifically ask people when was the last time they checked their blood pressure, they say, oh, just a few years ago and it was fine. But blood pressure really needs to be checked at least once or twice a year. There's no symptom when the blood pressure goes high and is outside of the sort of acceptable limits of normal. Blood pressure is often recorded as two numbers, the systolic or higher number and then diastolic and lower number. They're both as important as one another. One is the pressure of blood coming out of the heart, and the other one is the pressure of blood going into the heart. And the cutoff for high blood pressure is 140/90. But many women, and very regularly, women have much lower blood pressures in their reproductive years. So their blood pressure could be, 110 over 70, over 60. So when they come to reach the mid 130s over 80 something, that's pretty high, and we need to step in to try to reduce it. And I've seen, a lot of women with the right type and at the right time of starting the HRT to see a lot of improvement in their cardiovascular health as well. And of course, they're then encouraged if we can reduce some of their symptoms like night sweats, and they sleep better and their achiness resolves, they're more likely to begin to exercise on a more regular basis. And of course, that's an independent risk reduction activity. Introducing HRT at the, that window of opportunity, the window of opportunity being before a woman reaches menopause and completely diminishes with these protective hormones. So that's why, again, going back to the importance of checking and trying to replace with the right type of HRT and the right quantity at earlier decade than our 50s. And engaging in an anti-inflammatory lifestyle, because of the fact that majority of the chronic diseases that we start suffering from later on have an inflammatory basis. So it's a good idea to really pay attention to that. Our treatment options are many. We have choice, and it should be a really holistic strategy, what we do, starting from our lifestyle and trying to modify and optimize our lifestyle through the things that I just mentioned in previous slides. Also, nutritional supplements have a place, especially for postmenopause, and it's a big discussion. Sometimes it takes up, a chunk of our consultation time, rightly so, because I think it's really important to pay attention to, especially if you have certain conditions that prevents you from absorbing nutritional elements, or if you have sensitivities or sort of gut-related problems, like you're on antacid for a long period of time, or you have constipation, diarrhea, things like that. That it's important to then take a supplement to so that you're not deficient in those, important nutritions. There are many non-hormonal medications to ease the symptoms of menopause and perimenopause for those who choose not to take hormones or can't take hormones because of their pre-existing conditions like hormone-sensitive cancer or various things. And of course, there is a place for a big place for HRT. Now, when we talk about symptom management, of course, there's more options. So you can have non-hormonal medication, nutritional supplements, etc., to help you achieve sort of resolution of symptoms without taking hormones. But when generally we talk about prevention of chronic diseases, then really that only comes if you are replacing the hormones that are missing. So HRT, now we're just going to talk about that part of the treatment, so HRT, and I'll go through estrogen, progesterone, testosterone, because they are as important as one another, even when it comes to disease management, so prevention of chronic diseases and as an adjunct to chronic disease management as well. So estrogen plays a big role in our bone health. It actually reduces the breakdown of bone, and progesterone is more important when it comes to production of new bone cell. Interestingly, contrary to what a lot of people think, that only progesterone is important in bone health, but in fact, only estrogen is important, when in fact progesterone and testosterone are also very important. So if you have osteopenia, which is a step before osteoporosis, or if you have a predisposition to osteoporosis in your family, then it's an important, so even in women who've had, for example, hysterectomy and may not need progesterone for their endometrial protection, but we should really think about it in the context of bone health if we're trying to replace hormones for that reason. Estrogen is, we have many hormone receptors in our brain, including in where we make neurotransmitters that is really important for our mood. So, serotonin, noradrenaline, all of these. So in synthesizing the neurotransmitters, in how far they remain behind next to the receptors. So it's really important in the whole biochemistry of neurotransmitters. So if for people who have pre-existing clinical depression, anxiety, or they've just seen a sudden deterioration in their mood, although they were pretty old previously, it's really important to look at their HRT and try to replace and not just increase their perhaps antidepressants or anxiolytics. I explained about the importance of estrogen in heart health and, of course, in the urogenital health as well. Now, that's a very important and significant area that menopausal women, about 80% of women have some form of urogenital symptoms, whether it's vulvovaginal atrophy or urinary frequency, urgency, which, and of course, with the atrophy, they're more at risk of developing recurrent cystitis and urinary tract infection. And also, the atrophy and the extreme dryness may prevent them from taking part in very important cancer screening, like smear tests. So it's really important to directly ask and make sure that we've covered that during a consultation, and if you're suffering with any of these symptoms, to bring it up during your time with your specialist. Progesterone, of course, is extremely important in protecting the womb lining or the endometrium. So anybody who has a womb needs to take progesterone as well as estrogen. You can't just be on unopposed estrogen. But it's also really important in supporting your sleep, for maintenance of sleep. And it's also a form of anxiolytic. It works on the GABA receptors in the brain and it calms down the central nervous system. So even in women who've had a hysterectomy, we may choose to put them on progesterone still to help with insomnia, with anxiety. And also it has an anti-inflammatory property. And as I explained in previous slide, it's really important for bone formation. So it helps the cells that make new bone, osteoblasts, to start making bone. So if you see, or if you've been told never to take progesterone because you've had a hysterectomy, that's not entirely true. It really depends on what we're trying to achieve and on your symptoms. Testosterone needs to be used, of course, selectively and safely, but it is really important, not just for libido, which is, of course, it's important for libido, but not often people know about that, but it's really important for our cognition, for the focus, for concentration, for our brain energy, how fatigued you feel, sort of, and for that motivation and the zest for life. So if you have any symptoms related to these things, so cognition, energy, whether it's physical energy or your mind energy, where you just can't focus, lack of libido, and you feel that you're doing the same level of exercise, but your muscle mass is regardless deteriorating, is an important thing to check and replace in a safe way. Testosterone is always given transdermally across the skin, so you mustn't take a tablet of testosterone, and the levels do need to be checked to make sure that you're in the therapeutic window. There are so many various types of HRT, as I'm sure people who are taking it and the more sort of experience of our patients know about these. So they come, and these are pictures of a couple of them on the right-hand side, but they come as patches. There are estrogen-only patches or mixed patches, gels, sprays, and of course tablets. You can have vaginal estrogen. So, for people who either choose not to take systemic HRT, or they've been advised not to take it by their oncologist or other specialists, they can still be assessed for localized or vaginal estrogen if they have symptoms of, the vulvovaginal atrophy or urinary symptoms as well. Mirena coil, which is known as a contraceptive coil, but has some synthetic progestogen embedded in it. that is also used as the progesterone, sometimes as the progesterone part of the HRT, even post-menopause in non-reproductive age women. So that it can be used up to 5 years for that purpose. And then it needs to be replaced. So the long-term benefits, as I've described, is the reduction in long-term disease, so stronger bones, heart protection, and it reduces diabetes risk, and of course, it also improves brain health and cognition. So it improves quality of life, and it has about 80-90% symptom reduction properties as well. That's HRT. Now, some of the risks. The risks, majority of them that we know about stems from a study, WHI, the Women's Health Initiative, that was done about 20-25 years ago, that found a very small increased risk of breast cancer in the cohort of women that were on HRT, but they were on synthetic progestogens. So there's two main types of HRT. One is the synthetic or artificial hormones, and the other one is biological, which means that the chemical structure of the hormone is identical to what our bodies or our ovaries produced before menopause. So the small increased risk of breast cancer was found with the synthetic progestogens, and we don't have evidence for this in progesterones, although they haven't done the studies and concluded from that either. And the risk of blood clot and subsequent stroke and heart attack, etc., was with the oral estrogen. So, definitely the best route of administration for estrogen is transdermal, so via the patch, gel, or spray. And oral route of estrogen is really not the commonest way to do this because of the increased risk of blood clots, especially in those who've been menopausal for more than 10 years or they've reached the age of 60. But for most healthy women under the age of 60, in the absence of any particular risk factors in their history or any diseases that they're getting treatment for, usually the HRT, the biological HRT benefits outweighs the risks of it. So body identical HRT that you may have heard of, they're just biological hormones that are predetermined, it comes in predetermined dosages. So they're chemically identical to our natural hormones. They are regulated by the MHRA, Medicines and Healthcare Product Regulatory Agency, and they can be prescribed both by the NHS and privately. Now, body identicals or the licensed or regulated bioidentical hormones, the estrogen is either a patch, gel, or spray. The picture you see on the right-hand side is the spray, Lenzetto, and the progesterone comes as a capsule. So if you're taking a mixed, whether it's a tablet or not tablets, there's one tablet now in the market that is body identical, actually, with estradiol and body identical progesterone, micronized progesterone in it. But the majority of them, they're synthetic ones, and the patches, the mixed patches, are synthetic. Now, you can have bioidentical hormones compounded or made specifically for women. They come in custom doses. Just the picture you see is a lozenge or troche that has been compounded in compounding pharmacies. They're not mass manufactured, and they don't have the license with the MHRA because the final product is not licensed by MHRA, because produce per single prescription for women, and they can have slightly different dosage and different number of hormones in them. Now they do have their, I prescribe both regulated and compounded. There aren't that many prescribers of compounded bioidentical hormone in the UK, but if you've had the proper training for it and you know what pharmacy it's really important to have had extensive training and feel confident at prescribing it, but also really know which pharmacy you're using to compound your HRT with. But in situations where women have particular sensitivities to standard preparations of HRT, or they have intolerances of available dosage, they may need unique dosage. So it gives you that flexibility to work both with what is in the base of the HRT, so the non-hormonal base that sort of brings the hormones together, and also the quantity of hormone you put in it. So you can be very specific and say, they have this allergy or that sensitivity, or they've tried this and that, and the pharmacy can then formulate something and try them on. And the other thing that is really the occasions when I use it is for women who find it very difficult to adhere to multiple different things that they're using in a day. And they often forget to use like a really important hormone in their care, for example, progesterone. So I've seen them in their review and they say, oh yeah, I've been taking everything apart from that white tablet at nighttime for the past 3 or 4 months, because I didn't think I needed it. Well, you definitely need that, especially if you have a womb, because you need the endometrium to be protected against the estrogen that you're taking. So it is convenient to use compounded bioidentical, because everything is into one. And of course, it's quite reassuring knowing that they've taken everything at one go and they haven't just forgotten to take one of the hormones that was really important in their care. Sometimes also women have difficulty absorbing standard forms. So these are, there's usually something about the why we choose it. So it's not the first line therapy in most circumstances, unless women have already been established on it previously. And the quality can vary depending on which pharmacy you use and which prescriber uses, whatever pharmacy that they and their expertise of that prescriber. So it does require careful monitoring, and it needs to be under expert and experienced specialist advice. And it is usually used when standard options are not suitable or they failed. So the key take-home message now, to just summarize it, is that hormone health begins years before menopause. And it's really a good idea for younger women to understand that and try to get help and checked out when they begin to see some of these symptoms. You can dramatically reduce the risk of chronic disease in the future, but the window of opportunity to step in is actually at perimenopause. HRT is a health optimizing treatment and not just for symptom control. I think I've talked about it a lot in the previous slide, so I hope I've been able to highlight that for you. And of course, there's no one size fits all. So, you have many options within the standard dose of HRT, but also you can have specific ones made. So you don't have to give up and say, well, I tried the patch and I tried the whatever, and that's it. It didn't suit me, and I can just, so it's knowing that you have many options and you can really go for very personalized and bespoke care that is available. And yeah, of course, menopause, I often hear that, should I accept this? Should I accept that I don't sleep, or I'm just a bit more irritable or anxious than before because I've aged? You don't really. You have every right to expect to have a very fulfilled and a high quality of life throughout your life. You don't have to put up with this and that just because of your age. And it's really a new phase in life, and it's a good time. A lot of women that actually I see I'm inspired by them because they really take part in looking after themselves. They really pay attention to their own lifestyle, nutrition, supplements, etc. So I think don't look at it as okay, I'll just take some HRT to get rid of my hot flushes and that's that. So the important things finally to remember is, or if I had to give you just a quick list of things to do, is to make sure that, if you're feeling very tired and fatigued, that you've checked your iron, your B12, that you're taking enough vitamin D to make sure that your bones are mineralized and not at risk of losing density, that you check your thyroid, especially if you have symptoms that haven't resolved, because quite often, symptoms of hypothyroidism or an underactive thyroid can be very similar to perimenopause. So if you have these symptoms that despite taking HRT or treatment for it, they're still not resolving, check your thyroid, especially if you have a family history of underactive thyroid. Take protein at every meal, reduce your alcohol or intake, and quit smoking if you're a smoker. Pay attention to your gut health. Take some probiotics. If you are a sufferer with constipation, with acid reflux, don't just ignore it. Treat it. Protect your sleep. As well as your gut, your sleep deserves some attention and should be rectified if you're not getting that quality of sleep, in order to make sure that you've reduced your cortisol level. Move daily, whether it is just going for a walk, and just getting up from your seat, from your work or whatever that you're doing, just move about. And of course, specifically, do some sessions of exercise, your muscle training and strength. And if you have a sensitivity to insulin, make sure you do some of that HIIT or high intensity interval training. And look after your cortisol. I think we've reached the end of our presentation. Yes, great.